came out of fellowship, obviously as a sports medicine shoulder trained doctor, we also have a lot of training in residency with trauma specifically. And being in Boone, North Carolina is an unusual place in that there's not an influx of a large highway. There's not high impact trauma from car wrecks that we typically see. There are motorcycle wrecks in the area because we have a large amount of people who ride motorcycles on the parkway. Up here, we see a lot of isolated orthopedic fracture care, and that's because we have skiers, we have hikers, we have mountain bikers, we have patients that enjoy the outdoor running. And so all throughout the year, we deal with extremity fractures. And this can range from distal radius fractures of the wrist, elbow fractures, proximal humerus fractures, fractures of the femur, and fractures around the knee, fractures around the ankle. And so this is a field that all of my partners have become specialized in because of the geographic area that we are in. I would say during the week, on average, we are taking care of more than 10 fractures apiece during the week because of this. And so we've become very specialized with periarticular fractures, which are fractures around the joint, with fractures of necessity, like fractures of the both bone or the forearm, that need to be fixed. And specifically, we're in an area of high volume of patients who are coming up here to enjoy the outdoors. We like to pride ourselves in doing a good job of this fracture work, and specifically that when patients are visiting from out of town, we make time to fix those fractures so that they are managed well and then are able to go back to their normal lives at a sooner and faster pace, as opposed to waiting around, traveling home, finding a doctor to work with, potentially waiting another week for surgery. We give patients a choice. Obviously, if they want to go home, we're happy to set them up with that. But we also give them the option of helping fix them up here in Boone, North Carolina.